After 8 full days of Israeli strikes which have killed at least 194 Palestinians, including 36 children, Gaza is once again suffering from a severe lack of medical supplies. The Ministry of Health warns that hundreds of injured people, kidney patients and premature babies are in danger of dying due to an acute shortage in medicines and equipment.
We arrived to Shifa Hospital in central Gaza City, where most of the injuries are being treated, to meet with some doctors and take a deeper look into the situation in the hospitals in Gaza.
Middle East Eye met with the Norwegian doctor and solidarity worker Dr. Mads Gilbert, leader of the Emergency Medicine Department of University Hospital of North Norway.
I have been working in the medical system in Gaza for the last 17 years through many situations with Israeli attacks. But I've never seen the hospital of Shifa so depleted, so empty of supplies, equipment and everything you need to run a hospital. Really now it is on a critically low level. And I actually wrote a report for the UN before the attack started, where I said that the situation in Shifa is critical and it can break down any time.
Some suspect that the Israeli forces is probably using illegal weapons in its continuing onslaught on Gaza. In 2008, Israeli forces fired white phosphorus bombs on the people of Gaza. Dime is an experimental type of explosive that has small but effective blast radius that might turn out to have strong biological effects in those who are hit by the microshrapnel from these types of explosives.
Yes, we suspect that they are using dense inert metal explosive charges on the Hellfire rockets carried by the drones. We see injuries that we have not seen before. We saw them first time in 2006 during the Israeli Operation Summer Rain on Gaza. We saw them in 2009, of course, Operation Cast Lead, and we saw them in 2012 during Operation Pillar of Defense. The patients who have been exposed to these explosions, they are totally torn apart. If they are close to the explosion, their arms are cut off. Some of them are cut in two. We saw a young boy with double amputation, very high. And this kind of injury takes an enormous power to execute.
Meanwhile, doctors are seeking the Egyptian government to open the Rafah border, allowing doctors, medicine and medical supplies into Gaza. Noor Harazeen, Middle East Eye, Gaza.